The Alternative Dig Talk. Real issues, real talk.
Hey Teddy, have you noticed how little attention science and health issues get in the media?
Totally, Edgar, yet science information is very important.
Yeah, for sure. That's why the Health Journalists Network is here.
How can they help?
They are a group of journalists dedicated to advancing public understanding of healthcare issues through impactful reporting on health and science.
Oh, really?
Yes, they meet up every month with scientists and researchers, policymakers, and activists at the science media cafes. They then relay what they discuss to the public.
Does that benefit us?
Oh yes, very much so. This helps with health and science literacy for a healthy Ugandan society.
Okay. I love getting informed about science and health issues. Health information makes all the difference between life and death. I'll look them up and engage them.
That's great. They are based all over the country.
Oh, okay. That's interesting, and they should be making real impact.
They are empowering health communities through journalism. Journalists can save lives just like doctors.
The Alternative Dig Talk. Real issues, real talk.
Welcome to the Health Hub. My name is Esther Nakkazi. I'm a science journalist based here in Uganda, and I'm the team leader at the Health Journalists Network, a group of journalists in this country that write about health. They are based in different media houses, and they are very professional in what they do. Today, we are going to discuss the number of ways in which you can prevent yourself from catching HIV. We know that the numbers in Uganda are still high. We have had 38,000 new infections of HIV last year, according to UNAIDS, and that is very, very big. That's a huge number. But thank God we have scientists, and our Ministry of Health is doing a good job. There are so many options out there that you can use to prevent yourself from catching HIV. We have the pills, that is oral PrEP. We also have injections, and we also have the vagina ring. All these options are available, and they can be used by you to prevent yourself from catching HIV. The Ministry of Health has assured us that the injectable PrEP will be available in the country starting September. And this is called cabotegravir. It will be first available in different areas of the country, but I think eventually it will be available to all the people who need it. This is an injection that is given on the buttocks. It is a 2-monthly injection. That means you take it every 2 months, and then you go back after 2 months and you get another injection, and it is capable of keeping you safe from catching HIV. But we also know that we already have the oral PrEP, or the pill. It is called Truvada, and it is already available in the country. The ministry also told us that this oral PrEP is going to be available in the pharmacies. So you can walk to the pharmacy now and buy the oral PrEP. It's a pill. You can take it every day. And we shall see later in the program how you take it by the experts. But we also have a new study about lenacapavir. Lenacapavir is an injection that is injected twice every year. Uganda and South Africa were the 2 countries where this trial for lenacapavir was done. Right now, if somebody does not want to catch HIV, they can actually use that lenacapavir injection, and they can prevent themselves from catching HIV. It is a prevention. It is not treatment. You cannot be sick and take the injection. You have to not have HIV. Just remember that you have to be HIV negative, and you go and have that injection, and then you're safe from catching HIV. So let's listen in to the details of how these work.
My name is Dr. Herbert Kadama. I work with the Ministry of Health, AIDS Control Program, and I'm the National PrEP Coordinator. Currently, as I speak, we have 3 different PrEP options. We have the oral tabs or pills, which we call oral PrEP. Then we have the vaginal ring, the pivarin vaginal ring, which we also call the vaginal ring. And that one is inserted within the vagina. And the 3, we have the injection PrEP, which we call Kabla. I will start maybe with the tablets. That's what we started with as a country from 2017 up to now. As I said, we started with 800 people on the tablets, but as I talk now, the people we have ever put on the tablets are over 700,000. It is taken orally, once daily, for the women and men who are taking it for a long time. And the uptake really has not been that great continuity because of issues, you know, people have problems with pill burden, stigma. They are asked by their partners, what are these pills? Why are you taking these pills? If it is protection against HIV, are you having other partners? We are seeing cases of GBV. Even there were cases of access to the facilities. People were not having transport and were not coming back for for the tablets. We started going into drop-in centers. These are safe spaces for key populations and vulnerable populations. We started going into the hotspots, you know the hotspots, where mainly our KPs, sex workers hang, and even CDDPs. These are community drug distribution points. And we are taking the drugs up to the community so that we can really increase on the number who are continuing on on these medicines. But as I've said, that we are even thinking of putting these medicines into the into the facility. I mean into the private pharmacies, so that people can come and pick these drugs at any time to his nearest private pharmacy. There is no added cost to the person. It is the government which pays the 2,000 to 3,000 that the private pharmacy will ask for from a person. We have a memorandum of understanding so that every person who is served is given, you pay around 2,000 to 3,000 shillings, but that will be paid by government so that people can access these medicines in the private pharmacies as they go to buy their Panadol and other drug. That is how we are looking at it. That is how we are looking at it.
How will you ensure the private sector does not sell them?
Yes, we have a mechanism of monitoring. That the system we are setting up is that every medicine which is dispensed, the systems talk to each other. We know that they enter, and after every end of month, it is the government which is supplying these drugs to the facility. So when the drugs are over, they tell us and we replenish. So when we are replenishing these drugs, we take stock of the number of people they served so that we are sure that these drugs were given to these people. And these people, we tell them that it is a facility which will be referring people to those private pharmacies. And we tell them from the word go that these drugs are not for for sale. We have in Mbarara Health Center 4, Bufunda Health Center 3, that is in the Mbarara region. Then in the eastern region, we have in Namakwekwe, we have in Bison, and we have in Malaba, as Center 4. And in the north, we have in Chitugumo Hospital and Guru Regional Referral Hospital. So those are the people who are offering the vaginal ring currently. And as I said, the ring is inserted in the vagina, and it takes 1 day before you are protected. So before that, you have to use protective what? Method. And 2, the ring stays for 28 days. After the 28 days, you remove because the medicine is over. You need to replace with a new one. And this one, maybe it's not for coating, I don't know, but the ring is not for sharing. We have heard that some people use the ring and they give, when the other one gets a partner, he gives to the other one that let it come, then you bring it back. But the message should be very clear that the ring is not for what? For sharing. Everywhere it is free. It's being given free. And with the Global Fund, we are bringing in 4 new facilities. And this is in Masakaka, Sensero. Then we are going to be adding here in Kampala, the MAPI Clinic, most of you know it. Then we are bringing in Bugembe Health Center 3 in Jinja, and then Chenjojo Hospital. Maybe it might not be small, but those are the people who are accepting. This is a choice-based. You are not going to force people to use what they don't want. So if those are the people preferring the ring as a choice, we shall give them, but it also helps us plan. If we know that not many people are taking up rings, we shall not bring very many rings into the into the country. This is something coming in new in the country, and we are learning. We are just learning because we can't base on something that we expected this number. It should be given to us maybe that maybe in a certain country this number accepted, so we also base on that. But this is a new intervention in most countries, and we are learning, and these are the things which we shall be presenting. That in our society, you remember very well, sometimes we had a female condom, and it didn't do very well, and we reduced on it. So these are things we shall learn, and maybe as people experience more, and we get the satisfied users, maybe we might increase the number really going in for the ring.
I am Dr. Flavia Matovuchiwewa, a medical doctor with Makerere University, Johns Hopkins University Research Collaboration. I'm the director of research at that institution. I also teach at Makerere University, and I led the study of Purpose 1 in Uganda. I'm the national principal investigator for Purpose 1 in Uganda. So we conducted this study, Purpose 1, among young girls aged 16 to 25 years at 25 sites in South Africa and 3 sites in Uganda. And we wanted to find out if 2 products, one, an injection called lenacapavir, works to protect these girls from HIV, and then 2, another product called FTAF, if it works again to protect them from HIV. So FTAF has already been approved for preventing HIV, what we call pre-exposure prophylaxis or PrEP. Designed this study to test if FTAF can be used for women as well, since it has worked for men. And then we have an injection, lenacapavir, which is also approved for treatment. Lenacapavir is used to treat people who have failed on every other regimen, but in combination with other drugs, not alone. But now we tested it for PrEP, for prevention of HIV in young women, to see if it prevents HIV when it's used alone. So lenacapavir is a very effective or highly potent. It works to prevent HIV because its half-life, it stays long in one's body for 6 months, and then it works at different stages of HIV. When HIV is getting transmitted from one person to another, there are stages which it goes through. So lenacapavir can interrupt HIV at many stages, meaning that if it misses at the first stage, it can always catch HIV at another stage. That's why it's highly effective. But importantly, since it works for a long time, 6 months, it can be able to stay in someone's body when it's given for over 6 months. So Purpose 1 was conducted between August 2021 and then in May, and up to now we're still ongoing with the study. So in May this year, we have committees that look at what we do, so that in case you have a product in your study that's been shown to be effective, there's no use of going on with the study and then denying people in the other group who are also in the study from accessing that product. So the Data and Safety Monitoring Committee that looks at the data that we collect realized that in May that lenacapavir actually had protected women 100% from getting HIV in Purpose 1. There's no girl who got infected when they were in the arm of lenacapavir. Unfortunately, because the girls did not take their tablets as instructed, it's a problem even with the PrEP that's available. Girls struggle to take PrEP. So there were infections in the FTAF group, but also in the FTDF group. And when we looked at who got infected, there were those who were not using almost at all, unfortunately.
We first do sensitization. We first do what we call peers. We bring peers on board, their peers. We orient them, we teach them. And most of the times it is targeted awareness. The peers go into the society and talk more about what? The method. And it's the peer who are bringing in most of these people for the method. And they are the ones, eventually, when you have started, are the ones even taking these drugs or these rings to their peers in the community.
We're going to get more women get pregnant. Is it safer in more women, people who are breastfeeding, and also people who may come late? Because in the study, no one got infected, but in the open label phase, even if someone comes like 9 months later, can we still see no infections, or will the drug have gotten out of their body and there may be some infections if someone came late? So we continue to study the product until we have all the questions answered. So in the meantime, because even if we've shown that lenacapavir works, Gilead, the manufacturer of lenacapavir, is waiting for results from another study. There's a study called Purpose 2. So it's conducted in South Africa and other countries, other Western countries like US and Brazil. So when we get results, hopefully end of this year or early 2025, then when we have 2 sets of results, you can be 100% confident that your product can be licensed, and then you approach the Food and Drug Administration to approve the product. And then also countries have to approve the product in their own. Now here an NDA has to approve lenacapavir in country before ministry can put it in the guidelines for prevention. So we hope that that will take a shorter time, because as we speak, we have so many girls get infected. Over 3,000 girls get infected per week with HIV. So the world is really waiting, and we know that they are not able to take tablets. They struggle with taking tablets more than any other group. So we want this process as soon as possible to be completed so that we can have lenacapavir in our populations.
Being started by the woman without the help of the health worker, or can be inserted with the help of the health worker. So it is one of the most recent options which is controlled by the woman. And we started this under the Mosaic, PEPFAR Mosaic support in now I think 7 facilities, and Dr. Carol there is the investigator from FHI who is leading on this. We are in Bufunda, we are in Gulu Hospital, Chitugum, Namakwekwe in Mbale, Binson and Malaba in Tororo, and we're also in Imbarara Health Center 4. And so far 279 women have benefited from this.
Like any other drug, there are side effects, but these ones usually go after a short time. But most women have been reporting increased vaginal secretions I've been having some cases of urinary tract infections as a result of the ring, and some few cases of STI.
So they're going to reduce substantially, and then we'll be able to access lenacapavir for our young girls. But otherwise, it's very exciting that we have an option that girls can choose, but even other individuals. We did a study in women, not because it's only them who have HIV, who can get HIV, but because they're the ones who are at higher risk. They helped us answer the question quicker than if you enrolled a group of people who are not at risk of HIV, who would never have realized the results quickly like we have done. So though we investigated the product in young women, everyone is going to benefit, whether you are older, whether you are male, whether you are an MSM, or every population will benefit from lenacapavir. And we are really excited that we eventually have a product whereby someone has to remember only twice in a year that I have to take this product. Maybe you say mid-June and then end of year, or your birthday and 6 months after. So it's going to be handy, but also we need to, again, look at our facilities and do more research to see how can we deliver lenacapavir in our setting. Where can we give it? Is it in facilities? Is it in pharmacies? Is it in people's homes? So more questions continue even after you have researched on a product and found that it has worked.
We also have particular areas which are hotspots in this country. Districts like Gulu, Hoima, I think because of the oil, and there is a lot of development that is happening right now, plus Mbarara and Fort Portal. The numbers of people who are getting HIV are really high and they are rising. But like we explained before in the program, there are many options that you can use to prevent yourself from catching HIV. We know that the ministry is doing a lot to make this available, but if we have a prevalence of 5.5, which is what is happening right now, we may not hit the 2030 target of not having HIV infections anymore in this country.
Epidemic control, we want to have the number of new infections go below, less than isolated deaths. And just we have flashed this slide to show you that some of the countries in the region have attained that, but we are also on course. So you look at these two, the country is approaching a tipping point, like I've just told you. But there are regional and district variations. There are some districts where the new infections are very high. An example is Fort Portal City. We have good, the new infections are high. So we need to refocus our efforts, where especially there are more new infections and where there are more risks. So these interventions that we're talking about maybe also need to target the population in those areas. The burden is higher among females compared to males. But it is so surprising that the burden is high, but the men are dying. More men are dying. So I think there's some bit of carelessness among men which we need to add. I don't have a better word, but it's a bit of carelessness.
Back in the day, HIV was a scare, and our government introduced the ABC, which really worked to bring the HIV prevalence from 30% to now one-digit numbers. And there was a lot of A, B, C talk. A for abstinence, B for be faithful, and C for using a condom. These methods still work. We must also emphasize that Kabele or cabotegravir injection is not a vaccine. And lenacapavir, the 2-monthly injection, is not a vaccine. And these options are not for people who are already sick. They are for people who are not HIV positive. The PS, Dr. Diana Atwine, emphasized that. Take a look at what she said.
This solution is expensive, yes. But I do believe that those of you who have been around, remember in 1997, 98, when we were giving ART to patients of HIV, 1 monthly therapy, 1 month, it was costing, that time, it was costing, I think, over 1 million. It was costing, I think, 1.5 there. 1 month therapy. So we have come a long way. And that time, many people lost lives because they could not afford. And that time, we had not gotten this offer of free therapy. So now we have the free therapy. Even Uganda is manufacturing ART. So government is contributing. So we have come a long way. And I do believe that even these solutions that are seemingly expensive for the start, with time, the cost will start coming down. Because normally, they at the beginning, they are always very expensive. But I believe along the way, we'll be able to afford, even together with partners and government, we'll be able to pool resources and be able to afford to get these solutions to the people who need them most. We should not get comforted that all these solutions are, helping us to do away with HIV. HIV is still with us. It is a big enemy. It is draining our resources as a country. It is affecting our young people. It is still a big burden in our country. Before, remember that time when we would see the pictures of Philly retire and things were so scary. But now we cannot do that because there is hope that once people take medicines, they can live a normal life. Although that means they remain on medicines, and it becomes even easier if they get tested early and start therapy before their immunity is broken down. Because you see, when you get HIV for a long time, it attacks your immune system that even when you recover, when you take your medicines later and you suppress the virus and your CD4s raise, still research has shown that you are still vulnerable along your immunity does not recover to your pre-HIV. We still have stigma. Some people are still dying of HIV when they are hiding, and yet medicines are for free and everything is available. Even testing and everything is, and they can easily access even where they are. Before, people would travel all the way to Kampala to get HIV treatment. But now, even Health Center 3, they have ARVs. But still you see the stigma is there. Therefore, we need to continue talking and talking and talking so that everyone who is affected or infected can get help to make sure that we mitigate the effects of HIV. I know that when this solution was first talked about, it was like total treatment. Like once you get it, you say, hooray, things are done. I'm done now. I can go on the rampage. No. It is not 100% protective for the future. It will protect you for that incident. So if you don't and you continue exposing yourself without, again, taking it at the interval, it is 6 monthly, right? Yes, 6 monthly. Still you can actually get exposed. So the surest way we know 100% that we are very sure also is behavior change. That one I will not leave here without talking about that. We'll be excited to have all these solutions on board coming to help us for those that are really at risk. Because we have many, especially young people, we are happy to see that now the rings are more available. And other solutions. To those people who cannot avoid, to those people who are at high risk. But we do believe that really the best message that we can tell everybody, especially the young people, is that they avoid the risk. If it is possible to avoid exposing themselves to the risk that put their lives at stake. Because the solution could be available, it could be somewhere, but the person is this side and does not have the time to get to the solution. So we need to make sure that our message is not completely, obscuring the solution that helped us to bring down the HIV from 30% to where we are. And we know for sure that ABC model still works for us, and we need to continue talking about that. We welcome the PrEP solutions, we welcome the interventions, we welcome all these efforts that are joining hands with government efforts to make sure that HIV is reduced. We are excited to see that this one is just an injection and it gives you 100% protection at that time when you're exposed. We are happy to know this, and the people need to know that. But the question is, how soon, how quickly can everyone who is at high risk get this solution?
If you cannot use the ABC, abstain, be faithful, and using a condom, use the new options that are available. We have the oral PrEP that has been on the market for quite a long time, and there are about 70,000 people that are using the oral PrEP. We also have the Kabele, the injection that can be given in the buttocks, and it prevents HIV for 2 months. This has been available to the country through the USAID project that is taking it to some districts. But we hope by the time the year ends or next year, we shall have many districts that can make Kabele available. But we also have a new option, lenacapavir, that was brought on board after they did a trial here in Uganda and proved that this injection works, and it had 0 infections among the girls who used it. So that is another good option. And lastly, there is the vaginal ring, which can be used by women. It is very discreet. Men wouldn't know that you have the vaginal ring inside. You will not catch HIV, because these are proven products that are on the market and they have been well researched. We thank our researchers, we thank the ministry, and we thank our development partners, like you said, that are able to bring these products on board so that we are able to hit the 2030 mark of no HIV infections in the country. Thank you for listening, and tell a friend to go get these products. Thank you.
The Alternative Dig Talk. Real issues, real talk.